Recognizing that just about 3% of the over 2,500 persons who have tested positive for COVID-19 in Guyana are now dead, Health Minister Dr. Frank Anthony has expressed deep concern for what is now a spike in COVID-19 related deaths over the last month. The minister said this spike in deaths is likely to continue unless Guyanese seriously consider and take the preventative measures to flatten the curve.
This is not a Ministry of Health problem. This is a societal problem. Everybody got to be involved. So when you have people who are not complying with wearing masks, with taking social distancing, if people are going to go out and want to drink and go to parties and all of that, go to the seawall, congregate, all these things contribute to spread because we don't know who is an asymptomatic person who is spreading this disease. And when the guys go to a cook shop and stand up at the corner and they're having a beer while they wait on the food, you can get infected because you don't know who you're talking to. And we cannot overemphasize this information.
Guyana recorded its first COVID-19 case and death on March 11, 2020. And while other countries have done well to flatten the curve, the situation here is worsening. 5 months after the last death, the total number of deaths had risen to 35 by the end of August, representing the beginning of a steady increase in deaths and positive cases. But in 3 weeks, the number of deaths doubled, now standing at 71 up to news time. This shows that within the space of a month, Guyana recorded the same amount of COVID-19 related deaths it recorded over the last 5 months of the disease being detected here. Anthony said the trend is similar to what is happening globally.
These numbers, when you look at what is happening globally, these trends are similar in other countries, right? We, of course, we would prefer not to have any deaths, but the reality is we are having deaths.
Dr. Anthony said a large amount of those deaths accounted for elderly persons and others with comorbidities, underlying conditions such as cancers, heart disease, HIV, malaria, tuberculosis, and diabetes. Minister Anthony said Guyana has begun using remdesivir to treat critically ill patients. But even with the worsening of the situation here, countries close to Guyana have recorded devastating figures in COVID-19 cases and deaths. A look at Guyana's neighbors would show that Suriname has recorded a total of 4,740 cases with 97 deaths. Brazil has recorded 4,555,068 cases with 272,000 deaths, and Venezuela has a total of 67,443 cases with 555 deaths. Kurt Campbell, Newsroom.